Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you my top 10 list of tips for people with depression. Tip number 1, get screened. Depression screening can be done by a healthcare provider and involves asking a series of questions to determine if you have depression and to determine if there are any complicating conditions that could be existing with your depression, such as bipolar disorder or medical conditions that could be the cause of your depression. Tip number 2, find out from your healthcare provider if your depression is mild, moderate, or severe, and let your healthcare provider know if you're having thoughts of hurting yourself or others. With the same set of questions that are used to determine if you have depression, it can also be determined whether your depression is mild, moderate, or severe. If you are having thoughts of suicide, it's important to tell your healthcare provider immediately or go to your nearest emergency room. Feelings of depression are temporary, but actual suicide is permanent. So don't commit suicide. Go to your nearest emergency room if you are having thoughts of suicide. Tip number 3, exercise. Aerobic exercise for 30 minutes a day, every day of the week, which involves, for example, walking at a fast pace, not only helps prevent depression, but for people who are depressed, it helps improve the symptoms of depression. So it's important for everyone, whether or not you're depressed, to exercise every day. Tip number 4, relaxation techniques. There are a variety of relaxation techniques that can help people treat their symptoms of depression. So it's important to consider relaxation techniques if you are depressed. Tip number 5, light therapy. If you are having symptoms of depression that occur mostly in the winter months when there's less sun, you may benefit from a specially designed light box. These light boxes typically transmit 10,000 lux using their specially designed box, and you should use them for 30 to 45 minutes per day during the winter months if in fact your symptoms do occur mostly in the winter. Tip number 6, St. John's wort. St. John's wort has been shown to be effective for mild or moderate depression. The typical dose is 300 milligrams 3 times a day. It's important to talk to your healthcare provider before starting or trying St. John's wort, as it has many interactions with medications. Tip number 7, psychotherapy. For people with moderate or severe depression, psychotherapy is likely to be recommended. Psychotherapy is just a process where you talk to a healthcare provider or counselor about your feelings. Sessions are usually conducted in your provider's office for 30 minutes to an hour a week. The biggest benefit occurs when you can participate in these sessions for at least 8 to 10 weeks. Antidepressants. Antidepressants are recommended for anyone with severe depression, and if you have severe depression, antidepressants along with other forms of therapy such as psychotherapy might be recommended. Antidepressants help restore the normal balance of chemicals in your body. Early side effects are nervousness, headache, and stomach upset, and occur frequently during the first few days, but are typically gone within the first week. So it's important to try to stick out through that first week if you're having these symptoms. Medications usually take 6 to 8 weeks to work, so if you find that your medication hasn't worked in the first couple of weeks, still hang in there and see after 2 months if you have any improvement in symptoms. Lastly, medication should be taken for at least 6 to 9 months and longer, perhaps indefinitely, if there's risk for relapse of depression. And tip number 9, follow up. Especially if you're starting a medication, it's important to follow up either by phone or with a visit to your healthcare provider at least every 1 to 2 weeks for the first 2 months. And tip number 10, believe in yourself. Depression is a treatable condition, and you absolutely have the tools now to treat depression if you are in fact depressed. So good luck and have a happy life. Thank you.